This is Health Call Online, the place for extended versions of interviews you hear in our weekly radio broadcast, the Health Call Radio Hour, now heard in more cities around the country as stations join the Health Call Radio Network. Okay, we live in a world where 60% of us just aren't happy with the size of our body or how we look. So today I want to dig into a big debate, and that is, can you be fat and fit at the same time? So let's turn to obesity specialist at the University of Sydney in Australia. He is Dr. Nick Fuller. He's also the host of the 9 Minutes to Better Health podcast and the founder of the Interval Weight Loss Program. So Dr. Nick, let's see where you stand on this one. Can I be fat and fit at the same time?
Absolutely. The evidence is clear that, while being overweight does increase a person's risk of a range of health issues and metabolic diseases, such as heart disease, stroke, diabetes, and cancers, there's a lot of other research to show that a person's disease risk is not actually linked to weight, but instead body fat, and especially where it's distributed in the body. We get caught up on BMI calculators as sort of a be-all and end-all for our weight and where we should be on the BMI scoring matrix. But what we should be doing is actually focusing on other measures like waist circumference, blood parameters, because they give a better indication of our overall health. And particularly, what I'm referring to here is how much visceral fat we have, because this is a type of unhealthy fat that's stored around the stomach, close to the organs, and people with a high amount of visceral fat actually have a higher risk of disease than people who hold body fat around their hips. So I guess coming back to your question, Lee, you can absolutely be clinically diagnosed as overweight or having obesity, but still healthy. And this comes down to measurement of health parameters aside from just focusing on BMI.
Good to hear that. So let's talk just a bit about that visceral fat. So we're talking here about fat that is inside the abdominal muscle wall. So not the fat on the outside, but on the inside where it's actually in contact with your organs. What is there about this visceral fat that makes it that much more dangerous?
You're spot on. So visceral fat is stopping the body from working efficiently. Our organs have a variety of functions to enable your body to work efficiently. If fat is stored around the organs, it's preventing them from doing their job. And this is where that sort of overweight or obesity but healthy discussion comes into play. Because, for example, if you have a very healthy lifestyle and one that includes regular physical activity, you're going to have a low visceral fat even if you have a high total body fat, because you're going to be storing the body fat in different places and in different ways. And this is why it's important to move away from focusing on just BMI. It's a good starting point. It gives you an idea of where you sit on the scale, but it's not something that you should be focusing on from a holistic point of view when it comes to your health, because again, visceral fat versus the subcutaneous fat is a much more better indication of where you sort of stand. So what we can be doing is using a waist circumference for that. You can do it in the comfort of your own home, or you can do it when you go and see your primary care provider or GP, and putting a tape measure around your stomach and using a very simple, use starting point as your belly button. So make sure it's square around your waist, off on bare skin, and using a waist measurement of less than 88 centimetres for females and less than 102 centimetres for men. Now, to put yourself at even lower risk or very low risk of heart disease and cancers, it'd be less than 80 centimetres for women and less than 94 centimetres for men. So, you start looking at your health as a holistic picture and using other good indicators of health like waist circumference and going to your GP for blood checks.
Got it. So I understand, is the challenge here that visceral fat is crowding my organs, or is there something else about it? My understanding is that it's very hormonally active and it causes inflammation.
That's right, it does. It does cause inflammations. It's actually preventing the organ from doing its job efficiently. So when fat is surrounding and getting into organs like our pancreas, it's limiting the production of insulin, which then is released into the bloodstream to lower our blood sugar levels. So if we don't have enough insulin getting out into the blood, our blood sugar levels will be staying high and consequently putting us at risk long term of metabolic disease such as type 2 diabetes. So think of visceral fat as a limiting factor to your organs working efficiently. Like cholesterol. When cholesterol's dumped into your arteries, it builds up over time and the artery actually narrows, preventing that artery from doing its job. And in that case, allowing blood flow to the heart. So visceral fat is something that is stored in and around organs, preventing your body working efficiently. And an unhealthy lifestyle will lead to a build-up of visceral fat over time.
So, I've heard it called vicious fat for that reason. It's kind of the same, right?
Absolutely.
So so I may not be happy that I'm carrying a lot of junk in the trunk. I've got a big booty, or maybe I'm just kind of big all over. That's not quite the risk as if it's inside me. Can I have one or the other, or do they come together?
You can definitely be, again, can clinically diagnose it as overweight or having obesity on that BMI scale. So, greater than 25 is considered overweight, greater than 30 is considered obesity on that BMI index. But also remember that there's other limiting factors of BMI, and the muscle is much denser than fat. So it's another thing that the BMI can't measure. So it can incorrectly put someone in that overweight range when they have a higher muscle to fat ratio. So a BMI calculator can classify you as overweight or even obese, but if you're physically fit, you have a healthy diet, good sleep habits, and you have fat stored around your hips, you could actually be healthier than someone with a BMI in the normal range if they don't exercise or eat a healthy diet. So I guess that's answering your question. You can actually be at that higher end of the BMI calculator, but if you're active every day, you're following a balanced, healthy diet, good sleep routine, even if you have a higher fat percentage, it's going to be largely subcutaneous fat, which is not dangerous, and therefore you could be healthier than someone with a BMI in that normal range. So don't get caught up on how much body fat you have or what BMI score you have as well.
Good to know. So let's say that I come to you with a BMI of 30 or greater, which is technically obese. How are you going to determine what tests, or how are you going to determine if I'm fit underneath some of that fat?
Well, the first thing I'm going to do is actually measure your waist circumference. I'm going to see how much visceral fat you have using other indicators, remember, outside of BMI. I'm also going to send you away for blood tests so that I can check your risk factors for diabetes and heart disease. So I'll measure your cholesterol level, I'll measure your blood sugar, and I'll also take other measurements like your blood pressure and heart rate. That'll give me a more holistic picture of what your health looks like. Now, coming back to your question, I'm also then going to get an idea of what sort of activity you're doing day to day, get a better picture of your food or dietary intake and your sleep routine, because all of that together then gives me a better indication as to whether you could be, again, overweight but healthy. So how do we, I guess, answer that question about whether someone's physically fit? Well, we can use exercise tests. We can do simple tests like getting them to walk up and down a flight of stairs. If they're huffing and puffing from the minute they start that test, it's very likely that they are unfit and consequently unhealthy.
Do you look at cardiovascular health more importantly than metabolic health? Which one of those two do you think is more important that I focus on if I'm trying to improve some of my metrics?
Well, the great thing is our metabolic health is sort of a holistic picture that includes diabetes and cardiovascular health, for example. So when we're taking blood from a patient, we're actually measuring their metabolic profile, because being overweight or carrying excess weight does put us at risk of a significant amount of metabolic diseases. Some of those can be cancer, some of those will be heart disease, heart attack, some of those will be type 2 diabetes. So we don't want to just focus on heart health, because you could have a good cholesterol level, for example, but have a high blood sugar level, and consequently not necessarily at risk of heart disease, but you are at risk in this instance of type 2 diabetes, which is just as dangerous for our health long term. So that's why it's much more important to look at and collect as much information and data on that individual as possible, because again, we keep fixating on BMI, but it's far more than that when it comes to health.
I've noticed in the gym that I see people who are a little larger body size, and congratulate them for being there. Good for you. But I tend to see them on the treadmill and doing more cardio, and not so much in strength training and weightlifting. Is that the right way to play it? Why is that strength training important, or is it more important than cardio?
It's very important, and this is something that we're neglecting. 2 days per week should include body strengthening exercises. Now, these can be done in the comfort of your own home, particularly if you have, that sort of fear of the environment where you're going into a gymnasium and you've got the ripped bodies, etc. What you want to be doing, more importantly, is engaging in regular daily activity, but where you feel comfortable and where you feel happy. Now, if you are going to the gym, as you just mentioned, Lee, it's not about getting on the treadmill every day. It's about mixing up what you do. So I think what people fail to understand is that aerobic exercise is not the answer. It should be a mix of aerobic and strength training. So every time you're going into the gym, you should be doing something different. You've got to think of yourself like an athlete. If you mix up what you're doing, you're going to see gradual improvements in your performance over time. If you give an athlete the same training program day in, day out, they'll plateau off and they'll stop seeing improvements. The other thing you need to consider, if you are carrying excess weight, is that you've got extra stress going through your knees and hips, for example, your joints, which means you are more susceptible to injury. So to reduce or eliminate your risk of getting injured, and then not being able to do any activity, you need to incorporate a lot of non-body weight bearing activity. So an example would be, one day I go to the gym, I might get on the treadmill. Now the next day I might actually get in the pool, or I might get on the bike if it's the winter months in the comfort of my own TV or in the gym. But again, taking the stress off the joints and performing an activity that's going to allow you to stick to your exercise routine long term. So a day of body weight, follow it by a day of non-body weight. And again, don't just fixate on the gym or the structured activity. We need to focus on the incidental activity. Now that's where we incorporate more activity or exercise as part of our day-to-day life. Parking further away at the shops, using the stairs instead of the lifts, for example.
Yeah. Here's a tip. It may be blatantly obvious, but if you're an old guy like me and you go during the midday hours, early afternoon, late morning, a lot of those young muscle buffs they're at work. We feel pretty I feel pretty comfortable in the gym around a bunch of folks who are like me with some gray hair and a little loose. You know what I mean?
That is a good tip. It's about getting that time when it works for you, right?
Yeah.
Otherwise, we're going to be scared of that environment. We're less likely to go back.
Exactly. So can I exercise myself thin? I mean, I know a lot of people want to reshape their bodies, like we said earlier, junk in the trunk, or maybe I've got a big beer belly kind of scenario. Can I exercise my way through that?
Exercise plays such a vital part of any weight management program. So I guess what we need to emphasize here is that if you're about to embark on a weight loss or diet journey, if that weight loss program does not advise or prescribe some sort of exercise or physical activity routine, I'd be greatly concerned. And here's why. The first thing is that, as we've just discussed, you can be overweight or you can be classified as obesity and clinically diagnosed as having obesity, but still be healthy. And that comes down to largely how much exercise or physical activity you're doing. So you may not see any change in the scales, but what you will be seeing with that daily activity and daily incorporation of exercise is an improvement in your health. Your blood cholesterol is going to be coming down, your blood sugar level will be improving, your blood pressure is going to be going in the right direction, even though your weight or the number on the scales may not be going down. Now, the large reason why the number doesn't go down on the scales when we start our exercise program is because very few of us have a high baseline starting point. Most of us are barely meeting the measly 30 minutes of moderate intensity activity prescribed by governing bodies each day. So we start our activity programs, all we're doing is getting to that level that's considered healthy for heart health. So first of all, focus on those health benefits that you're going to be getting from exercise and make sure exercise is part of your weight loss program. Now, the second thing is that, coming back to your question, why exercise is so important, even if it won't see you, in that 3 or 4 size belt sizes less or dress sizes less, it's going to help you with prevention of weight regain. When you lose weight, you want to be losing weight from predominantly body fat stores. If you're losing it from body fat and muscle stores, that is not setting you up for long-term success, because muscle is the determining factor of our metabolic rate, or how quickly or how efficiently we burn calories at rest. So if you're focusing on a weight loss program that includes diet and exercise, when you're losing the weight, you're going to be losing it predominantly from body fat stores, holding onto your muscle stores. So when you've lost that goal amount of weight you're working towards, you still have the muscle, which means your metabolism's still going to be revving along, and it's going to help you keep that weight off long term. As opposed to someone who's just followed a diet, not focused on any exercise or physical activity incorporation into their weight loss program, they're going to be losing it predominantly from body fat stores. They're going to and muscle stores. They're going to be lowering their metabolism. When they hit their goal weight, they're more likely to regain back to where they were, because they've had a detrimental effect on their metabolism. So exercise is crucial.
So that's why you say that diets actually make you fat, right? I mean, that whole rebound effect?
It's a large part of it, but the other reason is because, remember, diets aren't actually addressing the real reason why we regain weight. And that is because we have this biological imperative to go back to our starting point. And what I mean by that in layman's terms is that when you start losing weight, your body starts working differently, because it says, hang on, in order to survive and procreate, I need to go back to my starting point. So consequently, you have this cascade of physiological responses taking place in the body to ensure that you put the weight back on that you lost. An example is our appetite hormones. They actually go up and tell you to eat more as you start to lose weight, so that you put more calories in your body and you put the fat back on, or weight back on, that you lost. So this is why diets aren't succeeding long term, because they're not actually addressing the biological reason why we regain weight. And then the second part is that they're not helping us form habits that last a lifetime. I mean, we can all follow these 4, 8, 12-week programs that tell us how many calories to count, what foods to cut out. and the strict militant exercise programs to follow, but it's not sustainable long term. Eventually we say, what the hell? We go back to our old ways and our old habits creep back in. So any weight loss program needs to address the physiological changes that take place within our body, and secondly, help you form habits that last a lifetime.
You know, we recently talked with Dr. Richard Johnson, the author of Your Nature Wants Us to Be Fat. He puts his finger a lot on fructose as a driver of weight gain. Is high fructose corn syrup, is it in all the products there in Australia as it is here in the United States?
It's not as frequently consumed, but I guess the important point to also highlight here is that, look, carbohydrates play an important role in our diet. For generations and tens of thousands of years, we've always sought out foods that are naturally high in sugar. But what we've done in the modern day environment is sort those foods out from processed and packaged foods that contain added sugars. Now, they're the ones that we need to be minimising in our diet, but we shouldn't be cutting sugar out altogether. We need to retrain our brain back to nature's treats, foods that contain natural sugars, like your fruits, your berries, your papayas. All of those foods that contain naturally occurring sugars and fats actually release the feel-good chemicals in the brain to give us that high we're looking for. And also those foods that are naturally found in the environment are full of vitamins and minerals and nutrition and fill us up for long periods of time. So yes, we should be moving away from the foods that contain those added sugars, but we need to be retraining our brain back to nature's treats because they still play an important role in our long-term health and weight loss journey.
You know, we are fat shaming is being discussed a lot these days. And I noticed a shift. I noticed you said earlier people with obesity as opposed to obese people. Is that part of a change in how the medical community is thinking about obesity?
Definitely. I mean, you know, and again, we sort of refer to it as clinically diagnosed with that condition or disease, however we refer to it, rather than an obese person or an overweight person. The other real big point to highlight is that it's very hard to regain control of your weight in the modern day environment. This environment is geared up towards weight gain, and our body is also working against us. It doesn't know any better. For tens of thousands of years, we went without food most of the time. It was hard to come by, and when it was there and when it was available, we would gorge at the sight of it. We would store and load up, but particularly on those foods that gave us best bang for our buck, the ones that were naturally high in sugar, naturally high in fat. Then our body learnt to store those calories and shut down during times of deprivation. Now, in the modern day environment, food's everywhere. It's on every corner of every block. And consequently, we have a hard time saying no to it. This is why we need to be able to retrain our brain back to nature's treats. But then secondly, what do we do after a weight problem arises? We look in the mirror, we see the 10 kilo increase over a 10-year period. We react through dieting. That is doing more harm than good, because all that's going to happen is your body will shut down with that weight loss diet, and you'll go back to your start point and you'll put on more weight than you lost because your body is gearing up for the next, I guess, survival attempt that it needs to go through. So when you do, or if you do have a weight problem, think about all these things we've been discussing. Weight is not everything. Health is more important. But don't react by signing up to the latest and greatest diet, because all they're achieving is the same results as their predecessors, which have now been around for the last 4 to 5 decades. Diets are only contributing to the very problem they proclaim to solve.
I think that's a good place to leave it. I think people will welcome the message that you can be fit at any size, and that once you're fit, size will follow. So I kind of like where all that goes. Dr. Nick, thanks. I always enjoy talking with you.
Thanks, Lee. Lovely to be on again.